Good evening, SG here from the Rehab Hub. So you've landed on this page, you've landed on this video because you're possibly interested in knowing what happens during the gait and posture assessment if you're interested in doing Pilates, reformer, or you're looking for rehab, you're needing that more healthcare professional intervention before you get started. This is me going to walk you through what will happen in that session so it's a wee bit more clear what we're actually going to be doing. So the first things first, like in here, it's kind of a bit Star Trek-y. This is our big gait lab, and we will marker up your joints. If I show you first of all some of the stuff in here, I'll not show you all of it, we'd be here all night, but what we've got here, if you can see these cameras on the wall, if I just clear myself out the way, those cameras on the back wall there are infrared, they're 3D cameras. And what we do is we work with a technology called Vicon, the Oxford University developed this system, and we are affiliated and linked with the guys at Oxford Uni. What happens is we put you in a 3D environment. So we use, if I show you, little markers, and these get put through, these little reflective markers get put in lots of different places in your body, and that pulls your body into this 3D environment. All of these little things get placed in different places in your body so that we can essentially, when you're moving on this in the gait lab, we can see exactly what your joints are doing and how you're loading your joints. So really it's not subjective, it's completely objective. So it's giving us accurate data that we can then use to then work out what we best do with you. Now, from there, and figure out what's going on, so why you're in pain, or why you've got injuries, or why things are not healing, we just help get you answers. After we've done the movement assessment, we will then do the musculoskeletal assessment. Now, what that means, so MSK, musculoskeletal, what that means is that we use an array of different tools. So I'll show you the kind of toolbox that we have in here. So the first thing we've got for measuring angles. So if we are measuring how much flexibility you have, we don't just gauge it, we actually accurately measure it. We'll use things like goniometers to, again, measure angles so we can see. So there's certain joints in your body. So for example, we know that your big toe, your first metatarsophalangeal joint, we need 65 degrees of motion in that area. So it needs to move to at least 65 degrees to allow normal forward propulsion. And if we don't have that, we know that will cause a cause and effect elsewhere in your body. So it's linking all of that up. So we check everything out, got a whole host of different goodies in this box. We take measures, we're measuring, making sure you don't have any leg length discrepancies. And we also do strength testing. So we check, we don't just guess and feel how strong you are, we actually objectively collect data from our strength testing machine. So we take all of that information there, and that goes into the Oxford Uni system, which is this big system here. And when you're in here, you've got this big screen, this big 50-inch screen showing you yourself in 3D, seeing how you're moving, and all of that's all explained to you. With this, we also do a posture assessment. Now, what we do with that is, again, we don't just eyeball you, we put you into a system, and we literally map out all your body, and we look and see for if we have any postural distortions. Now, all of that information that we are gathering, that's all of the information that we are getting, but we also get information from you. So your history, your medical history, all of the things that you tell us are all taken into consideration. And then based on all of that information, we then get the right plan in place for you. So let's give, for example, lower back pain. So say you've got lower back pain, you're going to book this because you think, actually, I need to be properly analysed. I want my gait and posture analysed so that I know that what I'm doing, I'm doing the right things, right? I'm actually doing the right things. I'm not doing something that's going to not help me, or it's going to make me worse, or whatever you're worried about. So you come in and we do all of this, and we discover that actually the problem is that you've got something going on in your hip. And the reason that your lower back is responding that particular way is because something down in this area is maybe not working as well. These are the types of findings that we generally find in many cases, usually where you experience pain isn't the root cause of the problem. For example, for the majority of patients who are suffering with knee pain, the actual knee joint itself isn't the root cause of the problem, it's the output of pain. But because of how they are loading that joint, because possibly other structures around, maybe down the foot, maybe down the ankle, maybe down the lower back, are then maybe not doing something they're meant to do, and as a consequence, the knee joint may be getting loaded in a particular way that's causing an output of pain, causing degeneration, or whatever it is that it's doing. Or maybe you're interested in this because you have possibly something where you've got maybe an inflammatory arthropathy. So maybe you have ankylosing spondylitis, or maybe it's rheumatoid arthritis, fibromyalgia, any of these types of things. You might be thinking, actually, I want to just make sure that I am on the right path. Now, as we've said, with this assessment, you get thoroughly assessed, and then from there, we would be best then able to tell you where your next steps are from there. Very difficult for me to say this is what will happen after this, but usually as part of this, movement's always going to be part of your rehabilitation. Always. And our method of rehabilitation in here at the Rehab Hub in Glasgow is Pilates. That is what we use to rehab our patients, and we have done it for numerous, well, taught Pilates now for 23 years, a wee while. So it is the method that we choose to use to rehab our patients. But if you're needing that more structured, more in-depth analysis, then this is what happens. So hopefully that just helps debunk that for you. It's a very, very thorough assessment. You will get a full report of findings with this as well. And it's something that the experience from it, most of our clients that we put through this, the experience that they get, they're blown away with it. It is phenomenal. It really is. It's quite futuristic, I suppose, and it's quite a nice experience. You see yourself in 3D in this big screen, see all your joints moving. But for us, it's the data that then outputs. So it's taking away that guesswork. There's no guesswork with this. It is as accurate as you're going to get. And you're getting this as data driven. That was the whole point from the company down in Oxford Uni that developed this system, is that it is of that research standard. And that's what we aim to work to the standard of within the Rehab Hub in Glasgow, is that we're giving you the best that is possibly out there for you. So we don't try not to guess and say, oh, it looks like you're doing this, but actually give you that objective data as much as we can. Actually, this is exactly what's going on. And then from there, we can then join up those dots and give you a proper, whether it's a diagnosis you're looking for, and then a management plan from that. So I hope that's helped. Please, if you have any questions, reach out to us. We're always, there's pretty much always a kind of open door policy in here at the Rehab Hub in Glasgow. We would love to hear from you. And if you're worried about injuries and things, please don't hesitate to reach out to us. We would be happy to help you. And hopefully we'll see you soon on having your 3D gait analysis. Speak to you later.